Okay. Good afternoon and welcome to the launch of Future Social Care Coalition, Time for a Fair Deal, although some would probably say past the time for a fair deal. The context, of course, is the COVID-19 pandemic, but this isn't just about COVID-19. It's about what's happened in the past and what needs to happen in the future. But what we have seen during this period, during this pandemic, is how much social care was forgotten. And then suddenly it was in the spotlight and exposed all those things that we knew were happening, the inequalities, the inadequacies, and the unfairness in the sector. In particular, its lack of parity of esteem with the NHS, and how long have people been talking about that. Incredibly poor working terms and conditions for staff, social care workers have been failed and are continuing to be undervalued. Now, there is a strong consensus, and you will hear this over the next hour or so, that the time is now. If we're going to make the case for this long overdue and much needed reform of social care, there is an immediate and urgent need to push for a radical reset to prioritize an under-prioritized sector. This is today a call for action. There is a pledge card you will see, and we want as many people as possible to sign up to this. And there will be, I think we will have Barbara Keeley, the MP, on later, who I think is tabling an early day motion. I want to get onto the speakers as quickly as possible. There is a little bit of housekeeping, which will hopefully come up on my screen soon, but you can see there the agenda for today. We've got some fantastic speakers, and also it's a discussion. We want as many people to be involved and to show their expressions of support for this coalition. Just on the housekeeping, if it can come up on the next screen so I can remember, critically, oh no, sorry, there is the advisory board, oops. There is the advisory board, and it is cross-party, and it is from different sectors, and I think that is a really important part of what's happening today. And if you go to the next slide, then we would like you all to tweet as much as possible at the FSCC and use the hashtag Time for a Fair Deal. Can you please use the chat function to share your questions and comments? We'll all be keeping an eye on those. There will be some polling questions that I will scatter throughout this launch, and it would be great if you would take part in that. Also visit www.futuresocialcarecoalition.org.uk to sign up to the pledge that I just mentioned. And panelists, please, can you keep your cameras on and your microphones on mute, and we will signal you if you forget to unmute when we most need to hear from you. So I think that is all from me, and it would be, I think we have everybody there. Yes, so let me introduce the first speaker, the forgotten frontline, and why we need to act now. Christina Mcinnea, who is Assistant General Secretary from Unison, but is also co-chair, along with Phil Hope, of this coalition. So Christina, I'm hoping you're there. Over to you.
Thank you. Thank you very much, Victoria. I'm delighted to be here at the launch today, and first of all, can I thank everyone who's been involved in this, because I think it's an amazing tribute to all the organisations and the individuals who've been involved in it, that we've come together, because as you said, Victoria, it's cross-party, it's employers, it's providers, it's commissioners, it's individuals who've got an interest in this and who've got a reputation as people who can bring something to this discussion and have got lots of experience to bring to the debate. And so I'm incredibly grateful to everyone for this. So just a little, Unison is the main public sector union in the UK. We're the biggest union. We're also the biggest union for social care workers and for the NHS. So in a sense, during this pandemic, we've been hearing from our members who work both in the NHS and indeed in social care. And it's been interesting to sort of contrast the relationships and also their experiences. And why this is so important is because we've been campaigning for this, and many of the people who are involved in this have been campaigning for this for many years, to get recognition for the key role that social care plays within our society. And it is about parity of esteem. It is about recognition of the fact that it's an incredibly important sector. And I think if we start to think of it in terms of what it adds to society rather than what it costs society, that would be a better starting point, certainly from a government point of view, I would argue. And you'll hear politicians talk a lot about infrastructure in the country, the need to invest in transport and energy systems and education, and how important these all are to the infrastructure. All very true. But there is a strong case to be made that social care is also and should be seen as part of the infrastructure, and therefore not a drain, but actually something that adds value to society by adding value to people's lives. And that's an argument I think we can make in terms of how the society ought to fund social care. And one of the key things for me has been about in terms of the terms of reference for this group and what the vision is going forward, has been the emphasis on the workforce. And you know, as a trade union, we're really keen and really hugely grateful to people for also seeing the need to invest in the workforce and have a proper workforce strategy. And we all know that when you try to deliver a service like this, which is a people-facing, you know, it's about providing services directly to people, to the community. Of course, you have to focus on the workforce, because you can't deliver an effective service unless you focus on the workforce. And we've been very keen to see that it's easy to get bogged down in discussions around structure. And of course, structure and funding are critical to any debate about the future of social care. But actually, you could get caught up and go round in circles on, should it sit with the NHS? Should it sit with local government? What's the role for the private and voluntary sector in this? Where does funding come from? Where does it, you know, who commissions services, who provides services? In actual fact, to have a focus which is on the workforce, I think is the right place to start, because the way you improve services, the way you improve standards, the way you improve the experience for the people who receive those services is by focusing on the workforce. And that's something that means if we get it right for the workforce, funding should follow that. Because if we can get, you know, if you think about where you start, if you only commission a service, what's it for? What's the group you're commissioning for? What are the needs of the people who you're commissioning for? And therefore, what standards do you need to make sure you're able to deliver adequately for their needs? And then you think about what's the workforce you need to deliver those services. And if they're to meet certain standards, what training do they need? And then that leads you to what pay should they be entitled to. This isn't rocket science. We've done this before. I was involved 10, 12 years ago doing this in the school sector with school support staff. I'm sure other people here have done it in other groups. But this is the right place to start. It's about respecting and valuing the workforce. And if we can't do it now, at this point in time, when there's been a spotlight shone on the social care sector, then it's difficult to know when we'll get such good buy-in from across the political and, you know, even wider spectrums across society. So I'm incredibly grateful to everyone, and I'm really looking forward to hearing everyone's contributions today. And I really feel that we're on the verge of being able to make some kind of significant breakthrough here, because we have got so much support for it. Thank you.
Christina, can I just ask before we move on? You just said that the discussion about where it should sit is sort of secondary to working out all those other things, but isn't that important to determine first of all where it should sit?
Well, I think, of course, it's important, Victoria, that we know where it sits, but actually I think you end up then getting into debates between, is it the NHS, is it local government, is it standalone, is it some kind of hybrid system? And, you know, you'll have vested interest then, I think, and obviously these are critical going forward, but I don't think it's paramount at this point in time. And I think if we can get investment in the workforce, standards for the workforce, a national, some kind of framework around pay and conditions with funding that follows that, so that providers know if they're putting in a bid to run a service, this is what it will be based on, and they will be able to offer these kinds of, this is what they could pay their staff, this is the way they can treat their staff, because funding will follow that. So for me, that's why it's more important that we focus on the workforce. I mean, they do go hand in hand. It's impossible to differentiate, to disassociate them. But I think having a focus on the workforce, for me, is the right way to go.
I was also interested too on the lack of mention in a way, and I think because we've become also obsessed with COVID, rightly so, but we've got Brexit coming up. And we know from all the discussions a year ago, doesn't that seem like a lifetime ago, about the impact on social care because of Brexit? How would this fit in with that?
I mean, it has to go hand in hand with it, because, I mean, Nadra and I, there's other people on the call who were involved in it, but Nadra and I certainly were sat on, we were co-chairs of the Cavendish Coalition, which was the body that was set up and is still going to deal with the impact of Brexit on the NHS and the health and care workforce. And the key issues that came out there were what would happen if staff, particularly in the care sector, where even managers in the care sector, many wouldn't hit the 25,000 plus salary to be able to get the right to come into this country to work. And we already knew that would have a massive impact on the care service, as in people would be leaving. They wouldn't be able to come back in and pick up work. There's already a big shortage in the care sector, and where are you going to find people who are trained to do it? And I think it's also about getting away from this idea that anyone can do care work, which again is a message that sometimes comes through from the government, that you can just take anyone off the street and they can become an effective care worker, whereas, you know, people are delivering care to people with complex needs, and it's not that easy, and that it certainly shouldn't be that easy, because there should be minimum training standards for people who are delivering certainly certain levels of care. So yeah, Brexit's massive. We're kind of still waiting to see what the long-term impact of that will be. And then there's still a campaign going to get the government to relax the rules in terms of what the salary threshold will be to be able to come in and work in this country. And I think there's a very strong case to be made, certainly in the care sector, for that, because and even the government must know, that there is still a skill shortage, a staffing shortage within the care sector.
I mean, that's an interesting point, and I think I will bring other people to ask other people to deal with this as we go on as well. But you talk about the government must know. The government does know, that is clear. But we are a long way now from, for instance, when the Prime Minister stood on the steps of Downing Street and said that there was an oven-ready deal for social care. We know that isn't there, but are you getting any indications from anywhere that there is movement in this area in government, that they are thinking about it?
I have to say I haven't received that yet. I haven't received that reassurance that there is a move towards that. What I would say is, when I've spoken to ministers or senior civil servants, I think there's definitely a recognition that I think even they were shocked at how difficult it was to effect change in the care sector, because it's so unlike the NHS. And I'm not saying it always works perfectly in the NHS, you pull a lever and things happen, but there's structures in the NHS to make it happen. But because care is so fragmented, because it's everything from big international companies running care to, Mr. and Mrs. Smith running a care home, and people doing care as personal assistants in individuals' homes. There's such a huge range. I think there was a recognition that how difficult it was for government agencies who were trying to bring in, to effect change quickly as a result of the pandemic, and that has hit home, I think, to people in a way that there hadn't before. And even trying to get money out, so if you look at the Infection Control Fund, even trying to deal with that has been difficult for the government. Or you look at the supply of PPE, how difficult that's been to try and get PPE out across that whole range of providers, because there's no structure at local level that necessarily brings everyone together, and in a way that means that, you know, you can actually say, this, here are the 3 steps you must take now, A, B, and C, and we want a report back by Friday that it's happened. And I mean, that just doesn't happen in the care sector.
I did exactly what I told people not to do. Forgot to unmute myself. Sorry. I was actually. I mean, you make such a good point there. Thank you, Christina, and we will come back to you at the end to help sum this up. Well, to sum it up, actually. And I now wanted to bring in Andy Burnham, who, as you all know, is the Mayor of Greater Manchester, and to talk about the Future Social Care Coalition. I am assuming he's online.
I am, Victoria.
How are you, Andy?
I'm well, thank you. I'm well.
Thank you for it. It will be a pleasure to talk to you about something else other than COVID specifically, just for a second. But if you are going to give the keynote address, and I will hand you over.
Thanks a lot, Victoria. I'm really proud actually to be joining this event today and to be part of this coalition. And it's great to follow Christina, who's such a powerful voice with the whole of the Unison in terms of justice for social care and the people who work within it. I think, Christina, you're right to say, let's refocus the debate and start with the workforce and think about the people who are out there today, 1.6 million of them in England, caring for other people's relatives, other people's mums, other people's dads, other people's brothers and sisters, because that's what they are doing. In my view, they are answering the highest calling in life. To do that is just an amazing thing for anybody to do that and devote their life to that. And yet, it's not the highest calling in this country, it's treated as the lowest, if you look at how we pay people. And I think that is just really a shameful reflection of our country, that we treat people who do that in that way. So I'll start by calling it as it is, I think, Victoria. The neglect of social care and the people who work within it shames all of the political parties in this country and my generation of politicians who've utterly failed on this topic. It's straightforward political cowardice. I don't think you can kind of put it any other way. A fear of having a difficult conversation with Middle England has stopped all of them for, what, 30 years now to do anything about it. But you think in that time, how many people have not had the care that they needed and have lost everything that they worked for, but also the people who were providing that care, just appallingly treated, really, by a system that has never particularly cared enough for them. And what we've had over the years is review after review, commission after commission, which has been the politicians' way of saying, oh, look, I do care and I'm doing something, when actually there was no real intent to do anything underneath. And I just think that's why I describe it as being shameful for my generation of politicians, because of what that means, what the consequences are of leaving a system that everyone knows is broken, but no one is actually prepared to fix it. As I say, it's a massive collective failure by the political classes in our country, and the inaction has had real human consequences. It's 10 years since I brought forward a white paper called Building a National Care Service. Now, I have to say, my own party didn't back it enough at the time. And then when I tried to bring it forward in opposition as Shadow Health Secretary. But I would also, though, make a stronger criticism of the other side, because not only did the coalition at the time not see the need properly sort out social care, rather than the financial cost to individuals through the Dilnot review. while that was going on, they were actually cutting social care and cutting it quite hard. I pointed out at the time that this commitment to protect the NHS from a funding point of view left them in a position where they were ransacking local government and particularly social care, and it really was duplicitous in my view. So in the last decade, social care has not just stood still, it has gone backwards. By the reckoning that was given to me, it would be £10 billion would be needed to bring it back up to 2010 levels. And then everyone can understand the consequences of that funding not being there for the people who receive care, but also the people who provide it. And this is where the cowardice of politicians has now had real consequences, because politicians have left social care at the mercy of a pandemic. Social care in England was in no fit state whatsoever to face what was coming at it with this pandemic, and we saw that earlier this year. And actually, a lot of figures that stick in our minds, aren't there, from this pandemic, the statistics that have been thrown at us. But the one that always sticks with me is the survey of care workers in the Northwest, carried out by Christina and Unison, which found that 4 out of 5 at the start of the pandemic feared they wouldn't be paid if they became symptomatic or if they needed to self-isolate. Now, you can kind of come up with a lot of statistics to show why social care in England is broken, but I would just offer you that one alone, and I don't think you need any more, because basically, if you have a system that is in the business of care for people who are vulnerable, that can't support the staff to protect their own health and therefore the health of the people they're caring for, you don't need any more evidence, I don't think, of a system that is completely and utterly broken. And for one moment that will live with me actually through this pandemic, it almost kind of really brought home how politicians have dealt with this issue, the pretense of doing something when actually there was no real intention. In the middle of the year, what was it, April, I can't remember, where we'd left social care staff without PPE, but they were given a badge at the Downing Street briefing. I mean, if nothing more brought over the superficial, patronising approach of politicians on all sides, to be honest, and I include my own, I'm not making a party political point here, I think that was it. That was the low point as far as I'm concerned, and that was 10 years after a white paper on the reform of social care that staff were given a badge. So I'm not mincing my words, because I just feel quite angry about this. It was one of the reasons that made me sort of fall out of love with Westminster. I have just seen how the sort of superficial goldfish soundbite mentality of Westminster leaves major issues unresolved. And this, I would say, is Exhibit A. It's the prime example of a superficial political culture that can't deal with the challenges that we face in the modern world. And I think this coalition needs to be quite direct in its messaging. I think that the time, as you said, Victoria, at the start, has more than run out. It's way beyond time for something to be done. One of the things that I've always found challenging when I've kind of campaigned on social care over the years is the frustration, and I guess this might get to you in the media as well, Victoria. Sometimes it's only a very small minority of people in the country who have direct experience of the social care system at any given time. Therefore, you struggle to get that sort of groundswell of feeling about the need for change. Most people don't know much about it until it's way too late, when their mum and dad start to need care, and it comes as a shock to them what they then encounter. But it's obviously not something that the average person is kind of fully aware of all of the time. But I think you said it earlier, there was a real moment earlier this year that was a kind of change moment where the whole eyes of the country were on social care, and they could see it in all of its kind of weakness, really, at a moment when the country needed it. And I think that was a moment where there was a kind of much wider understanding of how broken this system is, and how desperately it needs investment, and how the people who work within it need a much better deal than the one that they're being offered. So Christina's right. I don't think this moment comes back again. I think this is a moment to mobilise across the political parties, across the ages, to say that this change is not just overdue, it's way delayed, and it can't be delayed any further, because who knows, we could be in another pandemic in, it's horrible to think about it, but we could be in 5 or 10 years time. If politicians now leave social care underfunded and unreformed going into another pandemic, well, you know, that would be unforgivable. So let's look for inspiration more positively. You know, this country created the National Health Service coming out of the Second World War, when people would have said then there's no money to do anything, but actually then we did have that ability to bring forward big reforms. I hope that we will create the National Care Service, or the National Health and Care Service, coming out of COVID. I can't think of any better way of turning things into a positive legacy, and the right legacy for our country. This is my personal view, Victoria. You were asking Christina about, you know, the funding question and how it should be provided. Personally, I would have local government commissioning with a single integrated budget, and I would have social care overseen and provided by the National Health Service. They could work with other partners in the voluntary community sector, even the private sector, but I think it should come under the system of provision overseen by the NHS. Why? Because in the 21st century, the challenges that we're facing as a society, particularly with people living longer, means that you cannot anymore draw this artificial distinction between people's physical, mental, and their social needs, and try and meet those needs through different systems. The nature of people's needs as they age is that though there will be a blur between physical, mental, social, and you need to have a whole person approach if you are properly to care for people in the 21st century. And that's why I long advocated a system of that kind, and will continue to do so. I think it'd be the most efficient way of providing care, but also I think that is how you achieve the parity between the NHS workforce and the social care workforce that Christina was rightly talking about. You use the pay systems of the NHS to get that parity in terms of pay, but you also use what we used to call the knowledge and skills framework, the ongoing professional development that comes with a role in the NHS, and you extend that towards social care. So that is what I would do. But beyond all of that, as we are saying today, and the letter we've sent to the Chancellor, we need an immediate injection of funding into social care to lift people's wages in recognition of what they've done this year. Don't just give them a badge, give them proper pay to reflect the incredible calling that they answer in caring for other people's relatives. But beyond that, should be a first step to a fully funded, reformed system that we can debate again how best to do it. But in my view, the NHS is the most efficient healthcare system in the world. Why? Because it provides population-based care without the profit motive driving up costs. You know, we care for everybody in this country for less than 10% of GDP. And no other country actually can say that they have as good a health service as we do for that cost. So surely the same principle applies then to social care. We all of us together pool the costs and the risks, and then we provide it as part of a single integrated system. That in the end, I think makes it affordable. And I'll just finish on this point, if I might, Victoria. You know, as we look to the 21st century and the challenges that we've got, I don't think we will be in a fit state to kind of rise to the challenges of the 21st century until we have a health and care system in this country that supports people with dementia as well as it currently treats cancer. But if you look at the experience of those two groups today, it is dramatically different in terms of what happens to people. And how can any of us say any more that that is right? It's what life throws at you, whether or not you get dementia or whether you suffer from cancer. The principle should be that you get supported equally by a properly funded health and care system. And I don't think we'll be 21st century ready until that principle is fully enshrined at the heart of our health and care system. So I will leave it there. I kind of, my patience in doing social care launches, as you can tell, is kind of running out over the years. I don't feel I want to do many more. I want to see action. And I'm afraid from our politicians, to corrupt a phrase of the suffragettes, we've had words, not deeds, and now we need deeds, not words. Thank you.
But don't you think, Andy, just very quickly before we move on to the next panel, that is precisely the point, that a lot of people are fatigued with this ask, and there had been a lot of hopes raised that something was going to be finally done, but under various governments, including Labour governments, we never quite got there. Why are people going to think that this one is going to be listened to any more than the previous cries for help?
Well, I don't know that people do think it's going to be any different. I mean, I like anybody, heard the Prime Minister said they already had a plan. It was, you know, and that sounded encouraging. And as I say, I hope he sticks to his word on that. I'll support him if he does come forward with a plan. I do respect very much Camilla Cavendish, who is working on this issue with the government. I think Helen Walken, the minister, has got a real feel for it. So I'm not making any party political points here. I hope they mean what they say. But I just think you've got to grasp the taxation issue. And I've obviously got in trouble with this over the years, but I think you have to come up with a plan that increases funding both from general taxation, but asks the generation of people who are my mum and dad's age to make a contribute from what they have accrued over the years, because they're going to have to pay through care charges anyway. And this is the thing, isn't it, about social care? Politicians fear the word of any tax, death tax, whatever you call it, you know, whatever kind of measure you might call it. But actually, we leave them paying ever-increasing care charges, so they pay more by that less honest way of paying for social care, where you're just constantly increasing the charges. And this is why I say it's all about courage, isn't it? I think the political party that sorts this out deserves a big political dividend from it. And I would certainly say that, you know, the party that steps forward and say, well, look, this is difficult, but we can't let this happen anymore. This is what we're going to do. And yes, it's going to require more tax. But we're not prepared to have people who care for other people's relatives getting the minimum wage anymore. I would go out there and applaud them, and I would say they're doing the right thing, and they would deserve a political dividend for doing so. But why might we have more confidence? Again, just to answer your question, because of what we've been through this year. You know, which politician could say that they feel anything other than shame if the social care system faces another pandemic in the state that it's had to face this one?
So two fantastic rallying cries. Thank you so much, Andy Burnham, for that. And I want to bring in the next panel. We've got 1, 2, 3, 4, 5 who are just going to give make a brief statement. It's the cross-sector, and I think that is very important throughout today, that this is cross-sector, cross-party, the need for the Future Social Care Coalition and the need for urgent action. So if I just do it in order and get Caroline Abrahams to speak first, from co-chair of Care and Support Alliance.
Hi, thanks very much, Victoria. I think we are all probably violently agreeing with each other on almost everything. I'm just a bit, the CSA brings together organisations, charities largely, not-for-profits, that work with disabled people, working age, that work with older people, and that support carers. And we all come together to talk about and think about what do we want from social care. And essentially our aim is to secure a social care system which meets the needs of everybody decently who needs social care. It doesn't matter how old they are, doesn't matter whether they have a disability or not, doesn't matter if they have dementia or cancer, that everybody who has a social care need should have it met. And I don't, in a way, that sounds terribly ambitious at the moment, doesn't it? But it really oughtn't to in a civilized, advanced society. So I'm completely with Andy and others on that. I think from our point of view, we were particularly pleased to support this campaign because it's focusing on the people who are so often forgotten, which is the great people that provide the service to to older people, to disabled people, and who make life more bearable for carers. You know, very often informal carers, family, friends, not wishing to steal Helen's thunder here at all, but are working as part of a team which includes paid carers as well. And when unpaid carers have to do it all on their own, that's an enormous thing to have to do. And getting good support and feeling part of a team can make an enormous difference. And I say that partly on a personal basis, because that's how it is for me too. I sort of hold the ring, and I'm a part-time carer for my mum, but she has a retinue of carers who come in and support her. We're very lucky; we have fantastic care. But I know from every day of my life at the moment just what a difference it makes. And really, these people are very precious, and they do something incredibly important. It's just rather invisible to most of the public. Unless you've been there, you don't necessarily know what it looks like. You may have all sorts of stereotypes about it, but the friendship and support that I get is really valuable to me as well. And I know I'm not the only one on this call who's had that experience. So the idea that, particularly after everything that the care profession's been through these last few months, should get its just reward, should get a decent rate of pay, that we aspire to equalise, even if not immediately, but we set a goal of equalising the terms and conditions with the NHS for doing exactly the same job, so that we stop people just shifting across because they can get more pay. You know, we need to look at it as a whole system, and I think a great place to start is by looking at it in those workforce terms, to respect the special skills of care workers and reward them appropriately wherever they happen to work, whether that's in someone's home or in a care home, whether they're being employed by a disabled person through a direct payment to support them in living the fullest possible life. These are all tremendously important things, and they deserve a fair rate of pay. So that in particular, I think, has pleased us about this coalition, and I think it is actually the first one that has brought a cross-sector grouping together to focus particularly on the people who do the job, and I think that's as it should be, and just very pleased to be part of it.
Thank you, Caroline. And just to remind people that the request at this moment from the Future Social Care Coalition is an immediate £3.9 billion emergency support fund, and that's the letter that's gone to Rishi Sunak. I'm sure he will have welcomed that enormously today. Can I bring in Nadra Ahmed, who is the chair of the National Care Association?
Thank you, Victoria, and I'm delighted to have this opportunity to be part of this coalition, because I think I've been around a very long time, and I've worked with many of the people who are on the call and certainly part of this coalition. I represent National Care Association, who represent the small to medium-sized providers across the country. These are people who have invested their own time and their own money into delivering services across the country. And COVID has shone a light on social care, and it's also exposed the growing fragility of this sector, which is due to the neglect of successive politicians of all persuasions actually dealing with the problem in hand. And I think social care, it's important to recognise it's a patchwork quilt, which means that the needs of individuals are met. It's not just about older people, it's much bigger than that. And all of it faces challenging times. So we don't want to just focus on one particular element of it. So our workforce has to be very agile, and they're delivering all sorts of things across many facets of the sector. The two major issues that have really compounded us through these years, through decades, and I agree with Andy around the number of different things that have come out, the papers that come out, the commissions that are set up. It's very frustrating. But the two major issues are around funding and our workforce, and they're codependent. One without the other doesn't make any sense at all. So you can have all the money in the world, but if you haven't got the workforce to deliver it, you're not going to get anywhere, and vice versa. And I think that's why we are very keen to focus on the workforce element that this coalition is bringing together. Providers have invested very heavily in upskilling that workforce, because we have to remember what social care is. It isn't what it was set out to be, which was a pleasant retirement settings across country. It is now meeting the needs of people who were looked after in healthcare settings. And so our staff are skilled to that level. And it's really important to remember that when you're in a hospital setting, a nurse will give you your medication because that's what happens. But in a care home, we actually train our staff. They're skilled to that level that they will give you the medication. And yet there is no parity of esteem and there's no recognition, and the clapping doesn't really cut it for me. So I think we've got to talk about this workforce with a great deal more respect and understand its needs, but also understand how skilled they are. And I'm glad that Christina touched on the Cavendish Coalition and the work we're doing about the migration workforce, because that is a real problem for us. Not anybody can be a social care worker. It takes a very special person to actually deliver good care across. And any funding streams that come through have to be not only robust, but they also have to be absolutely sustainable as we go forward, because with the shortage of the workforce that we've got at this moment, we need to make sure that the people coming into our sector are not going to move back into retail as soon as everything opens up. They have to have a commitment to our sector, because that's what our sector needs. It needs commitment. We're proud to be social care providers across this country, and we think that people should understand that this is a sector that stands alone in everything that it does, and it has done it really, really well with very little support across time, and it's about time. The public have understood what we do. So the pay comes in once the recognition of skills is there, and I think we do need to make sure that the sector is understood for what it is, and it is the backbone of the NHS, and it will always remain that, and that's done because it's an independent sector, and if it needs anything, it needs its own Secretary of State to fight for it.
Thank you, Nadra. Can I bring in Helen Walken now, Chief Executive of Carers UK?
Hi, thanks very much, Victoria. And of course, I, absolutely endorse the urgent need to transform social care. But by definition, I think, as Caroline alluded to, I think you'd expect me to be coming from the perspective of unpaid carers. And unpaid carers have been propping up a crumbling, underfunded social care system for too long. And they themselves are now teetering on the brink, particularly during the pandemic, with their own mental and physical well-being at what can only be described as an all-time low. Respite centres closed, understaffed and under-resourced social care has meant that paid care workers have simply not been able to be there to support unpaid carers. And that means that 81% of unpaid carers have taken on additional caring responsibilities during the pandemic. And indeed, an additional 4.5 million people have become carers. And that takes the total up to 13.6 million unpaid carers who are relying on social care to support them, to have respite breaks, to undertake the medical and personal care that we're unable to, and also to enable them rather to juggle work and care. Before the pandemic, 600 people a day were leaving work in order to care. So in real terms, that 13.6 million people, ballpark, what, a quarter of the electorate. So that actually should make us think very seriously about this sort of as a cross-party, cross-sector issue. I think if the pandemic has shown us anything, it's that it's time to give back to carers, both paid and unpaid. We may not have known about the pandemic, but we do know that we've got an ageing population and a changing definition of family and a need for flexible working. So we need paid care leave, and we need an increase in carers allowance as part of social care reform. I think, the bottom line is that we know unpaid carers save us £132 billion a year with the care that they provide. And if a carer goes down, the health and social care system have to care for two people, not just one. So it would be, I think, quite short-sighted not to include a new deal for unpaid carers as part of that urgent transformation of social care. And I think finally, I'd just say that we probably need to remember that, that social care workers themselves are also often unpaid carers. If you look at the NHS as an example, and I would probably make it equitable with social care, 1 in 5 NHS workers are also unpaid carers. as opposed to the general population, which is about 1 in 7. So we don't just need that financial support for social care workers when we get them a new deal. We also need that flexibility in their conditions to enable them to also be, have the right to be unpaid carers in their own life. Because it's going to hit us all. We are all going to find ourselves in a situation where we're caring or being cared for. So I think it's sort of really short-sighted to not think of it in the round, if you like. So that's my 2 pence for the panel.
And very important too. Can I bring in Alastair Henderson, please, Chief Executive of the Academy of Medical Royal Colleges. Thanks, Helen.
Thanks, Victoria, and thanks for inviting me. So I'm Alastair Henderson, the Academy Medical Royal Colleges. We're the sort of membership organisation for the medical royal colleges in the UK, which are the professional bodies for doctors. So I'm speaking, I suppose, from a very core NHS sort of perspective, but we're supportive of this very much for sort of 2 reasons, I suppose. Firstly, the importance of social care itself. I think there is, and there has been a growing, in a way that wasn't necessarily there before, but a recognition from doctors of the crucial importance of social care that may possibly not have been there in the past, but also the complete interdependence of the system, that the NHS cannot operate effectively without effective social care system and vice versa. And that is, I think, recognised by health professionals now. I mean, in what I think was quite significant, our organisation, it was actually in 2017, so a group of doctors said that the priority for additional funding was social care rather than actually sort of NHS care, though we want that as well. So I think there is a recognition from the health system of the importance of this, and we're part of the Health for Care Coalition, which is supportive of that. The second reason, which is core to this group, is about the importance of valuing staff and what that means. And I think there is just now coming in the NHS a recognition of the need to better value staff, not just because it's the right thing to do for staff, but also because it leads to better care. I mean, in pretty simple terms, the phrase, happy staff means happy patients, and exactly the same applies in social care. So this is about improved care as well as improved sort of experience for staff. I think in the NHS, we are beginning to move in that right direction. The recent NHS plan sets that out very clearly, even if it hasn't been delivered everywhere. The strapline, making the NHS the best place to work and having a passionate and inclusive culture, seem entirely the right things. And I think it seems to me that social care staff deserve that recognition and action no less than NHS staff. And that's why we're very pleased to support today's initiative.
Thank you so much, Alastair. Can I please bring in Vic Rayner, Executive Director of the National Care Forum.
Thanks, Victoria, and I'm very pleased to be here and to see the launch of this coalition. So I represent the National Care Forum, which is a membership organisation for not-for-profit care providers. And I think just to begin, I just wanted to sort of reinforce the point Caroline was making in relation to the importance of the voice of people who use care services now and in the future. And I think that any discussion around reform, whether it focuses on the workforce or whether it focuses on funding or the vision for future social care, absolutely has to have people who use care services both now and in the future at the heart of its discussion. So I'd encourage us to think around that as we're having this discussion. I suppose the point, I think it's really valuable that this coalition is looking at workforce, and I agree with Andy's points in relation to the likelihood for this to have greater kind of currency at the moment. We've done some polling of the wider public, and one of the kind of key issues that keeps coming back is the recognition that the public has of the role that the workforce have played during the pandemic and just the fantastic role that they've played during that time. But I think when we start to talk about what that workforce will look like and how it needs to be supported and developed, we must focus that around the vision for what we want social care to do in the future, whether that is about how we think about how technology may change some of that role in the future, whether that's about how we incorporate some of the many skills that care workers have taken on over the years and have had to take on in an accelerated way during the COVID pandemic, where they've taken on many more health skills and expertise during that time. However we look at that, we need to make sure that our discussion around the workforce is very future focused in that way. And I agree with all the panel's frustrations about the lack of reform that has happened over many, many years. And I would also point out that not only do we not have a plan for social care reform, but we don't even have a plan for the social care workforce. And if we're going to start to think about parity of esteem with the NHS, we must be pushing urgently for a proper workforce plan. And I think that does present a really positive lever for us in terms of those discussions, one that builds on the awareness and understanding of the role of social care workforce and looks towards really cementing the right kind of reward, the right levels of recognition, I would argue, as well for regulation within that, and something that provides developmental and supportive pathways for people who are either currently in the sector or thinking about joining it and coming and bringing their values and expertise to it. Thanks.
Thank you, Vic. We have a question from David Brindle of The Guardian, who is also, I think, a chair of a care charity as well. He says, what's the answer to Health Minister Lord Bethel's comment last week that there simply isn't the management or political capacity to take on a major generational reform of the entire industry in the midst of this massive epidemic? I don't know who would like to comment on that. If you put your hand up and unmute yourself. There was a distinct lack of hands on that one. So I would say, I'd ask Christina if she's, oh, sorry, Alastair, I didn't see you gone. Yeah, physically put your hand up because I haven't got some.
Phil Hope here.
Oh, okay, sorry, Phil. Yes. So,
the difficulty for that with that argument that this is the wrong time to be doing it is that there's never going to be the right time to do it. And if there is, in a way, because of the pandemic, because of the great care crisis that we're going through, now has to be the time for making radical reform. Because if we fail to do that now, we won't do it in the future. We published the Health Devolution Commission report, Building Back Health and Prosperity, only last month, September. And that spells out a very clear direction of travel for the government if it wished to achieve some of those aspirations that Andy and others have been talking about. And this coalition has come about because we wanted to focus on one particular area of change, namely rewarding and valuing the contribution that staff are making and all of the things that people have said. But that is necessary, but it's not sufficient. We do need serious reform, and it isn't a case of not doing it now because we've had the pandemic. It's the reason for doing it now is because of the pandemic. And it just takes Matthew Hancock, Boris Johnson and Rishi Sunak, the equivalents of Andy Gordon Brown and Alastair Darling back in 2009, having the same conversation that we had with the same level of passion and commitment to arrive at the answers that we arrived at and to therefore put in place the change, the deeds, not the words. And I listened to Andy earlier and I was reminded of those cabinet subcommittees that Andy and I served on and the sort of hand-to-hand combat you have to have in government. That's the realpolitik. That was 10 years ago when we had a great care debate. We didn't have a great care crisis. So now is the time. And those three individuals could, if they wanted to, sit in a room with the civil service briefings and deliver the result that we're talking about.
Well, David Brindle's come back and said, I would say that try telling that to those who conceived the NHS at the height of the Second World War and then proceeded to implement it despite the post-war challenges. But I know, Phil, that that's what you were going to say as well. I would just ask you, while I've got you here, it's all very well to say, as Andy Gordon Brown and Alastair Darling sat round the table, but they were not in the middle of an international crisis.
That's absolutely right. So we do need to have the immediate actions that the leadership of the country requires to tackle the immediate crisis. But the point about this crisis is it has exposed the fundamental structural weaknesses in our health and social care system. Now it has exposed it. Now is the time, therefore, to repair, to make good those structural differences and weaknesses so that we don't repeat this, not just in the short term, it's about next year and the year after. And now is the time to put in place the processes to build the structures that means this doesn't happen again. And that we don't have the example I would want to give. There's an example live now of a CCG in an area putting up the rate that it's going to pay nurses in order to attract people to provide the staffing that they need. And that means that the care providers, the social care providers in that area, are losing their staff, who are quite understandably moving to the higher paid rates being provided by the NHS. So at a time when all the NHS talks about is collaboration, the reality on the ground, because of the funding differences and the structural weaknesses, is that the NHS is now taking staff away from the social care system, right now happening in care homes and in hospitals on the ground. We can't carry on now, let alone in a year's time, with that kind of reality. That's why this reform is essential.
Victoria, could I add very briefly, if that's okay? I was just going to remind you, you said we can't do something in the middle of a crisis. Phil and I were writing the green paper and then the white paper when we had another pandemic, which was swine flu. Now, I'm not going to claim it was the same as this one, but it was pretty all-consuming for the Department of Health, I can assure you. So government can always find the capability, as David Brindle said, coming back, we found it after the Second World War. And it seems to me that it's Lord Bethell, wasn't it, that you quoted? That's the voice of the deep civil service speaking there. It's always all too difficult, all too complicated. And it's going to take politicians to stand up to that and say, no, it isn't. I mean, Norman's on the call today. Norman stood up to the civil service and said he wanted reform in social care. But he's the exception, not the norm. People haven't done it. They've just gone along with this thing that it's all too difficult, and we need to leave it. Actually, just finally, what I think we're saying today is it's not going into a major reorganization straight away. There's a series of steps here, isn't there? There's an immediate funding boost that could go in at the level that you described before to get fairness for the staff, and to improve their conditions, recognizing what they've been through. There's then a next stage, I think, to sort of integrate social care with NHS staff in terms of the fair treatment and the training that Christina spoke about. And then you can go in a sort of slightly longer horizon towards the structural and commissioning changes that I was talking about. And I'm not necessarily saying the NHS takes over everything. It's just that the NHS could work with those quality trusted partners in the independent and the voluntary and community sector. And this could be a 10-year journey to a reform system. So don't let him get away with that comment. It's absolutely possible if ministers are, and if ministers are waving the white flag on social care before then we've no chance. But that's what we've got to have, people determined to make the change and laying out a roadmap to that change that starts with some of the easier things that could be done straight away.
We did have Kim Johnson MP on. She might have had to go. I don't know if she's there. No. Alastair, did you want to come in on that?
No, I think Phil sort of, and Andy and Paul Burstow said it, but absolutely. I mean, now is actually the right time to be doing it, not the wrong time to be doing it.
I just want to ask another question that's come up. Would a universal basic income help the issue of unpaid carers being able to survive loss of income due to their caring responsibilities? I don't know, Helen, if you wanted to answer that.
I mean, I say there's a huge number of different options and solutions. My bottom line is that £67.25, which is carers allowance, is the lowest benefit of its type. It's not had any support or increase during this pandemic, and it certainly needs looking at as a matter of urgency, because financially carers are currently teetering on the brink, and I think there's a more carers than unpaid carers using food banks, for example, at this time during the pandemic than before. So it goes right through the system. So that may be a solution. It may be one solution. The bottom line is we need a solution to carers allowance, because it cannot remain at the levels it's at the moment.
I will say that one of the hardest meetings I ever chaired was the Carers UK meeting. There were a lot of very angry people in that room. I think Kim is back on. Kim Johnson, did you want to come in on this? No, I'm being foiled. Sorry, she's gone again. Then there was just one last question before we come to the cross-party perspectives. It was on technology, and we just touched on this, but what is the importance of the use of technology? I don't know if Caroline, you wanted to talk to this.
Yeah, I'm not one of the biggest fans of technology in the sector, I have to say. I think at the moment there's a lot more technology could do to support providers in being as well organised as they possibly can be with all their backroom activity, which of course, if you're a care provider, is enormous and very complex. So, and yet we know not everybody can afford to have the best system. So I think it's definitely, I mean, I defer to my care provider colleagues on the call, but I suspect there's more we could be doing there. I don't think it's a substitute really for good hands-on care from individuals who are committed and well trained. I think it can supplement it sometimes. I think we're a long way off, to answer the question you've not asked, Victoria, but is often asked, which is, will we see robots in care homes or whatever? I mean, I don't think anytime soon, maybe in the future, who knows? But yeah, I think it's more about actually getting the basics in place everywhere and giving people the training and support. I know, for example, that in care homes during the pandemic, those that have been able to have a direct, iPad interface with their local geriatricians, for example, have found that hugely helpful to have them on tap 24/7. That's been incredibly supportive. But of course, not everybody had that facility. Not everybody has the training to know how to use these things. Not everyone even has broadband. So, we think we have to be realistic about where we're starting. But yeah, there's more we can do, but it's not a panacea.
I was literally thinking about robots when you said that, after we'd been to the Netherlands and seen a display of a robot in a care home, and I remember thinking I wouldn't want that holding my hand at all. I'm going to bring in the polling questions, the first one anyway. So if the participants here are ready for the first one. There are currently 112,000 vacancies in the social care sector. Do you think a comprehensive social care workforce strategy is needed to deliver greater skills, training and professionalism, as well as improved pay and conditions? I would be very surprised if there were too many no's to that, but let's see. I don't know if there is do we get a response at this stage? Yes, there we go. Not sure, 2% not sure. Okay, well, let's hope that the next panel can talk through this. Can I introduce the cross-party perspectives, why we need to win the arguments and why government need to listen to the forgotten front line? And let me first introduce the Right Honourable Sir Norman Lamb, former Minister of State for Community and Social Care.
Thank you very much indeed, Victoria, and I'm very pleased to support this initiative. I wanted to sort of make 3 points in the time I've got. The first is to say that I think our prime responsibility and focus should actually be our moral responsibility to those who need care in our country and who are being appallingly failed by the system. But if we are to meet that responsibility, that moral responsibility, we have to treat the people who work in care properly, with dignity, with respect, and we have to value them more than as a society we have demonstrated hitherto. And that means necessarily that we have to properly reward the people who do extraordinarily difficult and challenging work, but who are paid on the basis that simply does not reflect that skill and that responsibility. The second point I wanted to make is to focus on working age disabled people. Often the focus in this debate is on care for elderly people, and understandably so. But about half of the costs in social care go on the care of those of working age, people with a range of disabilities. It may be a learning disability, it may be autism, it may be complex physical disabilities. Often the budgets for the care of such people are very high. But what we have seen over the last few years is their personal budgets. This is the budget that has been defined as the amount of money needed to care for them. They have been trimmed back to the bare minimum, taking out of the budget all of the things that in a sense make life worth living, that give people hope and the opportunity for a good life. And you know, in the Care Act, which I took through Parliament in 2014, we enshrined in legislation this idea of a personal budget, giving the individual the right to determine what their priorities are. But if you trim it back to the bare minimum, it basically means that there is no choice available to people, and the amount of money spent on their care often leaves people confined to their homes and without any meaningful life. And it is a disgrace in a civilized society that we are treating people with disability in this way. We are treating them as second-class citizens, and that is not acceptable. The third and final point I wanted to make is, in a sense, to articulate a big worry that I have. You know, we are all coming together. We're coming together on a cross-party basis, and we're recognising, and rightly so, the extent of the political failure, which you know means that all parties in government, including the coalition, have been complicit in this abject failure of people in our country who need care. But if you look at the scale of the deficits, the state of our public finances, and the attitude of someone like Lord Bethell, who appears to be indicating that this is all too difficult to deal with, makes me very worried that this will simply again slip from our grasp, and that we'll be left waiting more years for something that has to happen here and now. And so it does come down, as Andy and others have said, to, you know, the mindset of those politicians in charge at the moment. They have to recognise the moral responsibility to act, and to act now. And there cannot be a further delay, because we are hopelessly failing families across our country by this complete failure to meet their needs. Thanks a lot, Victoria.
Thank you very much. Can I now call Paul Burstow, former Minister of State for Community and Social Care and Chair of the Social Care Institute for Excellence.
Thank you very much, Victoria. And I'm not really certain I'm going to give you a political perspective, because although that's how the this part of the agenda is labelled, I think what I'm going to bring to you is some reflections in my role as Chair of the Social Care Institute for Excellence. I think the first thing I was going to say was really, I think we all want to live in a place we can call home, with people and things that we love. And we want to be in a community which looks after one another. And we want to be able to do things that matter to us. And that's what great social care allows people to do. And the trouble is, we don't have enough great social care because it's underfunded, because the workforce is not respected and properly paid for, and because we don't take enough attention to the issues of how we should be focusing on as prevention as much as we should be dealing with the consequences when it comes to looking after people. So I wanted to just refer to a couple of things that the Social Care Institute for Excellence has been doing, which are very much in support of this campaign. I'm really pleased to be supporting this coalition launch today. Back in September, we at Sky published a piece of work that we have been doing with the sector over the last few months, looking at what the consequences would be of COVID, what we need to be doing in terms of preparing the sector for the future. And were very clear three things that we felt need to be part of the message to government. One is we have to move from this hand-to-mouth approach to funding. No more sticking plaster solutions to funding really has to be very clearly part of this. We need sustainable funding. Secondly, as I've said already, we need to shift from a focus which emphasizes and prioritizes acute spending, spending late on the consequences, to spending that is about tackling the causes and postponing the need for care in the first place, more prevention. And then finally, we have to recognize this is a workforce that has been dealt a very poor hand. It is underpaid, not well recognized, and needs to be better paid and high status going forward. And COVID has lifted the veil on this sector. For the first time, the public more than ever understand what this sector is about and the tough jobs that people are having to do in it. And my one political point is this: I agree with everything that people have said, and I take all of the brickbats as one of those failed politicians when it comes to trying to get this agenda across the line. And there are many of us who have that badge and don't necessarily feel we wear it with honour. But nonetheless, we also know some of the difficulties in government of trying to get this across the line. And I would locate the biggest stumbling block in government as being Her Majesty's Treasury. And regardless of the ministers in charge of that department, the advice to ministers is the same: kick the can down the road. Well, it's time to stop kicking the can down the road. It's time for ministers in the Treasury to say no to the advice they receive from their officials, because that advice is what's letting thousands of people in this country down. It's why no party has gripped this issue and delivered the long-lasting and necessary reform. So I'm pleased to be part of this campaign, and I hope that we have success cross-party and that this government actually delivers that fully baked proposal that the Prime Minister committed to only a few months ago.
Thank you, Paul. Do you remember the robot we saw in the Netherlands?
I do, and I mean, I agree with what Caroline said earlier on. You know, technology is not a panacea, but technology has a part to play. And if you use an occupational health lens, there are so many items of equipment that we build into people's lives so they can lead their life. And technology is just another part of that picture. It's how we enable people to have a good life.
Thank you. I don't think we have our next panellist on yet. I'm just waiting to see. But so can I go to Phil Hope, former Minister of State for Care Services and the co-chair of this alliance?
Yes, thank you, Victoria. I've already spoken once, so I won't take too much time. I just want to focus on this question about political change, really, because that's this segment of the session. And I just want to emphasise that the first thing I learned about as a minister was you need a burning deck, a compelling reason for change. Something doesn't happen in government just because it's nice. It's because really you've got to put it up the agenda. It's got to be top of the list. And I don't think anyone's going to contest the idea that we now have a compelling case, a burning deck of issues about the care system, about the care workforce and their undervaluing, and about the way the care system links to the NHS. The second thing you need is a very clear vision. My experience in government was, let's have 3 things I'm going to achieve while I'm a minister, and let's do those 3 things and get them done. Now, you have multiple responsibilities when you're in government as a single minister, let alone across the whole of government. But you get things done when you really focus on 2 or 3 main things that you want to get done. And this is why this coalition exists, because I think this is one thing that the government can focus on, can get done, which is to improve the way we value and reward our care system. I think there is a need for radical change. I've spoken about that earlier, but this is one thing that is doable and affordable in the current context to get right in the immediate short-term boost and in terms of a longer change. And the third thing you need is to get this across the line. You need cross-party support. I talked earlier about the internals of working, and I totally agree with Paul. The biggest obstacle to change was the Treasury. The way you tackle that is to get every single member of Parliament, 650 individuals, signed up to a single vision of what they want to change. Now, we all know the difficulties of that, about how the whips work and how ministers can't go against the government, all those details. But what we could do in this coalition is get as many of those MPs to really just say, look, after one thing we're going to achieve during this immediate crisis is we're going to treat our care workers fairly and properly. If we could get the vast majority of Labour, Liberals, Conservatives, Scottish Nationalists, everybody to sign up to a single idea of that kind, to get people rewarded properly, if we could get that done over the next few weeks and months, then I think we could achieve the change that we're talking about here. That isn't the long-term solution that I and Andy and others have been fighting for many years, but it's the one thing we could get done right here, right now.
I remember being in the room with you years ago, actually, when somebody stood up and said it was somebody from the House of Lords who'd said, the fact is my mailbox is not full of letters of complaint about social care because, quite frankly, the people who were having to deal with social care at the time were just too knackered to write a letter of complaint, and therefore MPs weren't picking up on the urgency of this.
Yep, that's absolutely right. And we have an entirely right sort of fixation on the NHS since 1948 when it was formed, and social care has been that Cinderella service in comparison. But there are 1.6 million people providing care. So all our friends and all our relatives, Christina couldn't have put it better at the start of this debate. And all of those people, I reckon anybody who was listening to the debate will know somebody who's got dementia, somebody with a long-term condition, somebody with a disability who relies upon that social care system. So it's time to broaden our understanding of what's important and to say everybody's lives are touched by the social care system. And in our case, touched by a broken system. Now is the time to mend it.
Thank you, Phil. Can I bring in Barbara Keeley MP, please?
Thank you, Victoria. I do welcome the launch of this coalition because I think it comes at a time of really when what we've heard on this call today is a long recognised crisis in social care funding, but it's become part of the public consciousness during the pandemic itself. So I think key thing that Andy said earlier about creating a change moment, I have had that feeling for some months now, and I think the emphasis on the care workforce is the key thing, really. During the first wave, we saw that care workforce taking on many of the same risks that NHS staff do in their course of the work, but the care staff did so while being much lower paid and very often without adequate PPE. It was such a battle at the start back in March, April time. So it's clearly right now to focus on getting a fair deal for that workforce and to keep emphasising, really, so many still earning less than the real living wage, many not being paid for all the hours that they work, and a quarter of staff being on 0 hours contracts. Have to keep emphasising those points, I think. And I think we've touched on this a few times, Victoria, but one of the most notable changes during the pandemic was a widening and a deepening of public understanding of the role of care staff and of some of those workforce issues through really many in-depth reports on broadcast media. That's what did it. So when COVID infections started spreading in care homes, there was the coverage on the reliance that the sector has on agency staff and a study on how staff moving to work in different care homes had created the risk. And the focus on those staff vacancies that you've just put up a question on, the 112,000 staff vacancies in the sector, that may have been news to a lot of people, but we know, I think, on this call today, that shortages of staff and high staff turnover have been having a major impact for some time, as have that low level of training and low pay. Yet, what I think we've seen, and I've been involved in panels that have taken a lot of evidence over the last number of months, despite that low pay, despite all those issues, care staff have actually come through the first wave of the pandemic as key workers who deserve better. There is a very strong feeling now that this is a group of people, a very large care workforce who deserve better. If we think about it, they handled terrible waves of infection and frequently very high mortality rates in homes which were not designed like hospitals for infection control. They're designed for communal living, and they're having to adjust now entirely the way that they organise that. And I think what we've seen too is care staff stepping up too, because district nurses stopped home visits and domiciliary care staff had to take on extra tasks there. GPs started to rely on video consultations with their patients in care homes. Care staff took on a wider role. And I think you really cannot get away from the fact that the biggest challenge for staff was stepping up to deal with end-of-life care for many patients, with deaths happening in very quick succession. That was not part of the role before the pandemic. So we've talked about it. Nadra talked earlier about respect. This work on the front line of the pandemic has to lead to improved recognition of the role and value of care staff. It has to. And that means competitive pay, pay that reflects the skilled nature of social care work. And it's got to start to be a key focus for government. Andy focused earlier on the announcement of the badge. The worst aspect of the badge, and I think, you know, handled well, it might have been something that staff appreciated. There are 1.5 million care staff in the workforce. Only 90,000 badges were distributed. So only 90,000 of them even got the piece of recognition that was meant to make a difference to their lives. Now, just to finish then on how we can tackle this on a cross-party basis, the Health Select Committee recently, and that's a cross-party committee obviously, called for additional funding of £7 billion a year for social care, including £3.9 billion to cover demographic changes and to uplift staff pay in line with the national minimum wage. We did include further measures to protect people who face catastrophic care costs. I feel that that's the minimum that we need. I think we should aspire to much more investment than that. But Labour members on the committee were also supportive of the case for introducing free personal care, because that was in our manifesto. And the Lords Economic Affairs Committee made a really persuasive case for that last year. So I guess the key question for us now on this panel is, how do we achieve that? I've talked about some of the factors. I think we're all here today because we believe the time to act is now. And I look forward to working to support that action. Perhaps the point to end on is this: let's have no more failed politicians' badges, as Phil has just talked about. Let's have a successful politicians' badge. Let's be the era of politicians that did this. And I do believe the time is now.
Thank you so much, Barbara. Can I bring in Clinton Farquharson, who is Think Local and Act Personal? I wondered if you wanted to comment on what you've been listening to so far, Clinton.
Thank you, Victoria. I fundamentally agree with it, everything that everyone's said. As a disabled person and as a person who employs my own personal assistant, this is really important to me because it's about a life, not a service. And we would fundamentally agree that a national living wage is needed. As experience, I've heard a lot from the workforce. We know that people in social care and everywhere have been working flat out, trying to do the best by people who they work with, especially the forgotten front line. And I would like to mention personal assistance in this conversation. However, I think the conversation in England is centred on three elements of function, form and finance. And we have come unstuck. As my colleague Anna Severite pointed out to the Health and Social Care Select Committee, we're asking how to fund social care without asking what social care is for or how it should work. They've ignored her pleas in the report, as a result not proposing how to finance and implementation of the Care Act, but instead put forward the idea such as free personal care. We need to discuss more than that. I need, and many other people need, more than just personal care. We need to have a life, and we have to have, I think Paul Burstow mentioned the social care future. That's the future that matters most to me. I want a life, not a mere existence.
Thank you, Clinton. That's very powerful and actually to the point, because it is about even deciding what is social care and what does it look like. I wonder, attendees, everybody listening in, if you have any questions, do put them into the chat box and we can bring you in on this. And I think Helen Hayes was on earlier. I don't know if she is still here, if she wanted to say anything. You always have to wait a while, don't you, to see if it comes Maybe not. I think there's a vote about to happen. And I just wondered, actually, also if Simon Bottery was on from the King's Fund, and because the King's Fund has done so much on this, if he can come in on it. I might be being foiled by technology here.
I am actually, as it happens.
Yeah, good. Well, just give me some of your thoughts, because the King's Fund has done so much looking at social care. What's resonating with you here?
Well, I suppose if I'm frank, Victoria, you know, people who know me know that I agree with what's being said. You know, I have strong feelings. I've campaigned and worked in this area for a very long time. So what is it that, why don't we make any progress? So I think one of it is we have to reach beyond the coalition of the people that are on this call. The people that already get this, already believe it, and actually have already sort of made up their minds about what a solution looks like. And accept that if we're going to make progress, we're probably going to have to compromise. We're going to have to accept that it's going to take place over a period of time, and we're not going to get everything that we all want at exactly the time that we want it. So that would be my challenge, if you like, which is to say, you know, what are we prepared to think about? What aspects of social care reform are we going to prioritise for the absolute immediate future? And what are the things that we might have to accept are going to take a little bit longer?
Thank you. Very succinctly put, and a challenge. There is an element, I mean, we were saying this right at the beginning, where everybody really is agreeing with each other. This would not make for good Channel 4 news viewing. But it is patently, a lot of people feel very passionately about this. I wonder if Lord Lipsey is on, if he wants to add any words. No, I'm just going to go to a poll. Oh, sorry.
Problem with the unmute only came up after I'd started speaking. I've been on this for 20 years, since I was on the original Sutherland, the first of the commissions, the Royal Commission on Long-Term Care, first of the many commissions that led absolutely nowhere. I would just make a political point, I think. This will only get done successfully on a cross-party basis. It is no good the government setting out one policy, which Labour then promises to repeal, all the people won't know where they stand, because a change of government could be a change of policy. However, 2 attempts at that have failed because they've been sabotaged, each by one political party. The first time, the Tories sabotaged near agreement by calling Labour's proposals a death tax. And the next time, Labour sabotaged Tory proposals by calling them a dementia tax. Now, if we are this is a difficult question. I have more sympathy with the politicians than some people on this call, because I know how difficult it is. But if we are to solve this position, there have to be all-party talks, and the people on both sides now are perfectly sensible people, capable of making progress. I also think it essential that the government appoint a mediator in those talks, not to lay down to anybody what the outcome of them should be, but so that if either party behaves as disgracefully as both parties did last time round, the mediator can say, Labour's sabotaged that, and that will help to keep the talks on the track. I think a solution is within range. I think we've got quite close to it following the Dilnot report, and I greatly I'm greatly in favour of the new emphasis on workforce. I've been asked by successive care ministers what one thing I would do if I had a few pounds to spend on social care, and the answer is always pay that money to care workers. But I think we need proper talks with a proper mediator determined to make progress.
Thank you so much for coming on. I just wanted to call in Councillor Richard Kemp, if he's on, because there has been a question about local government and the role of local government in delivering and funding this.
Thank you, Victoria. I would point out that, of course, that the people who actually deliver social care and have the strategic responsibility are local councils, and we have to do it, as has been rightly pointed out by others, the time of acute pressure on all our budgets. But the point the local government makes is that we have to consider social care in the round. What we do in terms of our public health, the facilities we provide to keep people well in the community is vital if we're to deal with the increased number of people who are getting old in particular. But the point I particularly want to make is the Local Government Association is an all-party body. I happen to be a Lib Dem, but any of my three party spokesman colleagues from the other parties could also comment on this. We have tried 5 times since 2017 as an all-party body to bring together the national parties and the national parliamentary parties. And on at least 3 of those occasions, we've been lucky to get 1 or 2 replies and no action. Do you think that there's a role for the LGA in working with you all to try and get this all-party consensus, which we can display in local government, having produced 5 green and white papers in the time that the government hasn't produced any?
Thank you, Richard. Can I ask Denise Platt from the GMC next? I'm not sure if you're
yeah, I'm here. Sorry, my sorry, my technology slightly defeated me for the moment. I feel like the ghost of Christmas past listening to this, as the person that produced the very first State of Social Care report and tried to draw to government's attention around about 2005, the fact that social care funding was a miss, and thought it was a great success the very 1 year in a public expenditure review when we managed to get a 7% increase on social care funding, when the NHS was getting a 7% increase on social care funding. And I remember saying to Tony Blair at one point, you're expecting social care to integrate. It's a bit like asking a Reliant Robin to compete with a Ferrari. And his response was, I'm amazed you think the NHS is a Ferrari. So I think there are some very deep-rooted issues around here. I am here, sitting here as a member of the GMC. I'm a lay member of the GMC. I come to the end of that at the end of this year. But more importantly, I'm on the verge of a consumer of social care. The disability that has encroached upon me in my old age has brought me to a realization of the lived experience of lots of people, including what Clinton said. And I can only agree with him that social care is actually about a life, just not an existence. And some of the difficulties about integration with the health service are that the health service sees people as clinical pathways, not as lifestyles. And that's when you have to get through some of those real cultural barriers. It's a bit like the NHS is from Mars and social care is from Venus at a time. You think that we're talking a common language, but actually we're not. The words we use can mean something very different in very different circumstances. So I think there are a lot of cultural issues to get over here. I managed to get the disaster that is social care currently, or the challenges that is social care currently, into the GMC annual report as one of the contexts in which doctors have to work in future, and that it's absolutely critical for doctors in training in future to understand their role in multidisciplinary teams, and that their role might not always be to lead those teams, but to be participants in them and to actually support care workers who might be leaders in some of these circumstances. So I'll keep niggling at them to try and get some of those things said. But I do remember Stephen O'Brien saying to me at one point, Denise, we'll only get social care changed when people on the doorstep, when they're being knocked on the door for their vote, actually raise social care as an issue. And when the debates that people go to as candidates, people in the audience raise social care as an issue. And I think that there's something to be said about doing that more forcefully. I could go on forever, but I won't.
Thank you, Denise. I just wanted to bring in Matt Wart from Anthony Collins Solicitors, if he's there.
Yeah, thank you, Victoria. Yeah, I was picking up on the comment that Phil made earlier on about the applying for jobs in the NHS, nurses applying for jobs in the NHS where social care staff are currently being paid less than their counterparts in the NHS. And if we're going to talk about pay parity, I think it's really important that there's a proper understanding of actually what that's going to cost. So a case can really be made as to why that's the right thing to do. And it was really asking whether any of the panelists are aware of any financial projections that have been made to look into that.
Thank you. I would just come back. I just think maybe we have Lord Kerslake on now. He was running late, if he is there. Not looking like it. Can I just quickly do the question 2 of the polls, and then I'm going to bring in Jill Morris. So question 2 of the polls is, did you know that half of the 1.6 million social care workforce on the forgotten front line earns less than the real living wage, and up to a quarter are on 0 hours contracts? Okay, do we have an answer, a response to that? Well, a lot of people seem to know that that's the case. And can I now, I want to thank you all for your contributions, and I'm sorry there is so much more that could be said, I know, and so much more discussion, but I would like very much to bring in now Jill Morris, who's on the Secretariat of the Future Social Care Coalition.
Thanks, Victoria. I think it's been a fantastic session. And just to underline that the Future Social Care Coalition, it's not about just launching it or the frustrations we've heard from many on the call. It is about actually getting that sign up and building that coalition. We've got a fantastic cross-party, cross-sector coalition already, and amazing former ministers and amazing people on the call today. It's about galvanizing that support and using that moment in time that we have looked at to see some seismic change. That is the big point. This is, we're not going to let up on the campaigning, but we need to broaden that out. So we do have ways for the public and others to engage and show that support, to make it a doorstep issue or an inbox issue for parliamentarians, and to make it really sexy. If we are going to see that parity and equality that we've talked about today, and we all do, we're all singing from the same hymn book, we really need to get that understanding out there. And I think, you know, as we've discussed before, I think people do feel passionately, you know, about the need for quality social care in this country, but maybe they don't realise it just yet. But there's everybody in this country at one point or another will have need for social care. So it is a big, it is a hot ticket in policy, but as too often the front line is forgotten, as we've discussed today. So the things we're doing, thanks very much to Barbara Keeley for taking the charge with the early day motion, a basic parliamentary tool, but we will be doing more on that. So again, we want that is cross-party. We will get as many people as possible to, or MPs to sign it. We want all parliamentarians to sign the pledge card, which is on the newly launched website. We're thinking also around the need for a parliamentary public petition to see that seismic change and really get a movement behind that. All the advisory board and all the organisations really need to pump this out through their membership and get really get those voices and people saying they do care. We will be doing parliamentary activities, but to drill down on some of the 3 key points around the workforce, around parity, and about immediate funding, we will be drilling down and using that support and holding, hopefully, the government to account. We've written the letter to Rishi Sunak. I'm sure it's very much at the top of his inbox, but it is for the first time, I think, that we've actually gone out big time with a cross-party, cross-sector coalition. That's what makes it unique. I know there's nobody on this call who will not support the coalition. I just ask you that you get behind it and we carry on and use this moment in time. It's not going to be a very good month, if not God knows how long, but I do call on everybody to sort of use this opportunity to support those pledges, and let's see if we can get some change. That's enough from me, and just thanks for everybody who's got behind it so far.
Thank you, Jill. And just to say, Matt, in case you haven't seen it in the chat box, Christina has tried to answer your question, although saying there is a difficulty as the lack of data, hours and rates of pay, which I think is one of the questions that probably needs to be addressed quite quickly. Getting data these days is essential for winning arguments. Data coming out of my ears when it comes to the pandemic. Can I ask Christina Mcinnea to, first of all, begin a sum up of and just a few comments, concluding comments?
Thank you, Victoria. Thank you so much for chairing this today. And it's been, I think you've been able to ask some really incisive questions. And I think Phil's going to come in as well and say sum up. Just a few points for me. Really fantastic contributions. Again, so grateful to everyone for giving up the time to come to this today. And I think the key for me to take from this is that this isn't just a one-off. Jill said that this is the start of a process, and this is about how we keep it in the public eye, how we keep pressure on politicians, how we keep the media interest going when, as you said, this has been about for a long time. You know, we're all identifying the problems, but it's where do we go next that's important. And I think for me, it's also important that, and I know everyone, and we are preaching to the converted today, I realise that, but it is important that we keep reminding people that this is about people and people's lives. And Clinton put it very eloquently about what this actually means to people who rely on care, who get care, but it's also about the lives of the people who provide the care and support individuals. And again, it's the stories of their lives and what this means going forward for them. For me, there's been a few key things coming out of this. Bill's idea about getting every MP to sign a pledge, I think is a good one. I'm wondering also if the way forward is that we have a small group of us who seek a meeting just to make the point that this is cross-party, it's cross-organisations, it's providers, it's the private sector, it's the voluntary sector, it's the public sector, all asking for the same thing, that we ask for meetings perhaps with a government minister or Camilla Cavendish or both, just to continually make the point that now is the time, because it does feel very much as though there is a window of opportunity here, and then there will be a point where things start to go back to more like normal, and people will forget how amazing this was, and it will drop off the public interest, and this will fade. And so I think we've got a 6-month window here to really push hard on this and try and see some significant change and make people realise there is public support for this. And if politicians would be brave, I think it would be less risky for them this time round than perhaps it has been in the past. But thank you very much.
It was a fantastic call to arms and some very good ideas. Phil, Hope, can I ask you to add your comment?
Yeah, Victoria. So first of all, I just want to thank all the panelists and all the people who have attended today, because I think it has been a really energizing feeling on this discussion today. I really feel quite empowered by it, and a feeling that we are building a genuine coalition for change, which is very exciting. That this is part of a wider agenda. This focus is on the workforce, the care workforce, getting that right. But as we talked about earlier, this is one step on a bigger journey for reform and transformation of the health and social care system. So we are ready for any future crises that might come our way. And I suppose it's a call to action for everybody here who's a panelist, who's an attendee, who's got a website and on Twitter and on social media. I think we've got to really maximise the engagement. If everyone here could use their networks, use their alliances, use their contact lists to sign up to the pledge, to make it clear they're supportive, to contact their MPs, to get people engaged with this discussion, then we can turn what is a crisis into an opportunity. I know that's a very optimistic way of looking at it, but I think this is the moment when we can do that. And it occurs across the professional sphere, in the public sphere, and most importantly, in the political sphere. And if we can get all of that to come together in one go, then I do think this is an achievable goal that we can put our hearts and minds into achieving.
Thank you, Phil. Can I just congratulate all of you, because I know that I have watched you over the years really fighting on this issue at different times and in different ways. And I'm very impressed by the amount of fight that you still have left in you. And I think that you are right, probably now is the time. And I want to remind everybody who is still listening to please sign the pledge. And I am sure that there will be another one of these conferences organised soon to give us an update and what your next steps are. But thank you so much to the panellists for making this a very easy job for me, and good luck with your fight. We will be watching very closely.
Thank you, Victoria. Thank you.
Thank you.
Thank you.